From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
Welcome to this news roundup. I'm Jennifer Abbasi, Director of JAMA Medical News. Associate Managing Editor Kate Schweitzer is here. Hi, Kate.
Hi, Jen.
So, Kate, you're going to tell us about a landmark study that aims to fill gaps in knowledge about Black women's cancer risks and outcomes. But first, let's talk about what's been going on with the U.S. Centers for Disease Control and Prevention website in recent weeks. As lead senior staff writer Rita Rubin reported for us in her February 18th story, possibly thousands of web pages referring to HIV and other sexually transmitted infections, contraception, gender, and racial and ethnic disparities were removed from the CDC website on January 31st to comply with President Trump's executive orders. Some pages were restored within a few days. In some cases, though, their wording had been changed or sections deleted. Physician organizations have mobilized to oppose the changes on the CDC's pages and other websites under the umbrella of the U.S. Department of Health and Human Services. On February 11th, a district court judge for the District of Columbia granted a temporary restraining order stating that Health and Human Services, CDC, and the FDA had to restore web pages and data sets to their versions as of January 30th. Judge Bates's order came at the request of the nonprofit Doctors for America, which is awaiting a decision on its lawsuit challenging the removal of the web pages and data sets. The lawsuit was filed February 4th against the Office of Personnel Management, the CDC, the FDA, and HHS. The judge's opinion memorandum cited a statement issued February 6th by 6 medical specialty groups, including the American College of Physicians, the American Academy of Family Physicians, the American Academy of Pediatrics, and the American College of Obstetricians and Gynecologists. The groups called for the restoration of data sets and guidance that have been pulled from the CDC and National Institutes of Health websites. They pointed out that these resources are not just academic references. They are vital for real-time clinical decision-making in hospitals, clinics, and emergency departments across the country.
Jen, can you tell us more about the data sets that were pulled down?
Yeah, so on February 1st, most of the experts who serve on the congressionally mandated advisory committee to the CDC director sent an open letter to the acting CDC director, Susan Monarez. The letter cited 4 missing data sets. 2 of them, the Atlas of HIV, Hepatitis, TB, and Social Determinants of Health data, and the Youth Risk Behavior Surveillance System, were restored shortly after the letter was sent. The Environmental Justice Index and the Social Vulnerability Index were restored February 12th after Judge Bates's temporary restraining order instructed the CDC to reinstate the missing web pages. We spoke with Dr. Nirav Shah, a senior scholar at Stanford University's School of Medicine, who has served on the CDC Director's Advisory Committee for nearly 4 years. And he said it's important to be thoughtful about the downstream consequences of deleting data sets. For example, FEMA and state and city governments used the Social Vulnerability Index to help determine where to locate shelters after Hurricane Harvey struck the Texas coast in 2017. And as for the Youth Risk Behavior Surveillance System, Dr. Shah said that if you care about teenage suicide, you care about this data set. Now, despite restoring the pages as ordered, the Trump administration discredits them. The CDC website for several of these data sets and other pages have a new banner at the top. It reads in part, "Any information on this page promoting gender ideology is extremely inaccurate and disconnected from the immutable biological reality that there are 2 sexes, male and female. And this page does not reflect biological reality, and therefore the administration and this department rejects it."
Oof. You mentioned that to fill the information gaps, many groups and even individuals have stepped up. Can you tell us a little bit more about this?
Yeah, so medical and journalism organizations, medical journals, and even just concerned citizens are mobilizing to make the missing information available in its original, unaltered form. A coalition of scholars and journalism organizations, including the Association of Healthcare Journalists and the National Association of Science Writers, has formed the Health Data Preservation Project, which provides links to archived public health data. And organizations like ACOG and journals including the Annals of Internal Medicine, the American Family Physician, and JAMA are making certain clinical content publicly available. But science evolves, and experts are concerned that even as many CDC pages are restored by the agency, they may not be updated in the future to reflect the latest science. And so that's where things stand now, and we'll continue to follow these developments. Okay, Kate, let's turn to another piece we published in recent weeks. So tell us about the Voices of Black Women study.
Thanks, Jen. Cancer has affected every demographic group, but according to the American Cancer Society, Black people, and Black women in particular, are often more at risk. We know that for most cancers, Black individuals have the highest rate of death and live the shortest amount of time after a diagnosis compared with all other racial or ethnic groups in the U.S. And although Black women are less likely than white women to be diagnosed with breast cancer, they're 41% more likely to die of it. And disparities don't end there. Black women are also historically underrepresented in research, which is why the American Cancer Society has launched a landmark study to build on the existing, though insufficient, knowledge base for this specific community. The population cohort study, called Voices of Black Women, aims to be the largest ever study of Black women in the U.S. We're talking a goal of enrolling more than 100,000 participants over the next few years. What also stands to set the study apart from the ones that preceded it is the investigation into less understood factors that disproportionately affect Black women's risk of cancer. Take, for example, beauty products. Certain hair dyes and chemical hair straighteners that are predominantly used by Black women have been associated with a higher risk of breast cancer. Other areas of exploration will include daily lived experiences, whether it's discrimination or workplace interactions. It will also key into factors like generational wealth and social support. Now, the goal of the Voices study is to better understand this population's unique cancer risks and outcomes, but a step further, the researchers behind the study envision that some of the discoveries could be used to guide public health policy or medical interventions. And of course, the ultimate hope is to simply improve the overall health of Black women and to begin to narrow and ideally fill this major gap in cancer epidemiology, one that's persisted for decades.
Thanks, Kate. So tell us more about the details of the study. So who is the study targeting and what will be involved for those participants?
The American Cancer Society's research team is seeking Black women across the U.S. between the ages of 25 and 55 years old. They're seeking diverse backgrounds and income levels, but registrants cannot have a history of cancer. If selected, the participants will be followed up for 30 years. This will include an initial online survey of their health histories, behaviors, and lifestyle. They'll log info about their diet, sleep patterns, even tattoos. An optional sub-study invites participants to provide a blood sample along with some basic vitals so that researchers can also glean how factors such as ancestry and genetic changes or hormones may influence cancer risk as well. From there, they can expect 2 30-minute check-ins annually. The thinking is that with just an hour of investment each year, participants will be more willing to commit for the long haul. Now, the study's team intends to complete enrollment by 2027, but research can begin as soon as 10,000 women are on board. So far, it has 3,000 participants signed up.
So there's still a long way to go. What are the potential roadblocks to the success of this study?
That's true, and you're right, it's not without its challenges. To date, the largest study of Black women enrolled about 59,000 people. That one, called the Black Women's Health Study, was funded by the National Institutes of Health and launched back in 1995. So the target of 100,000 participants is certainly ambitious. On top of that, you have to consider the history of mistrust among this population. A member of the Scientific Advisory Board for the Voices study cited past mistreatment and, again, the chronic underrepresentation of Black women in research and medicine. So you can see why the target demographic may be hesitant to make such a long-term commitment without many meaningful results thus far. To help repair this relationship, that Voices Advisory Board is intentionally made up of all Black women, experts across disciplines. They're devoted to building trust in the community and ensuring the study is well-designed. So they're reviewing survey question language and partnering with historically Black organizations to promote participation. And there's more to be optimistic about. Even though Black people still have a greater cancer burden than all other groups, a recent report from the American Cancer Society shows that the cancer mortality rate has decreased among Black people in the U.S. over the past 30-odd years, from 49% to 33%. Those are encouraging results, even if there's still a lot of work to be done. Our writer spoke with one of the study's co-principal investigators, Dr. Lauren McCullough, and I was struck by how she took pride in being the very first person to enroll in Voices. McCullough put into perspective how truly monumental this study may someday be. She said that it won't just be informative for the generation of women who choose to join now, but also for the generations of women who come after.
Thank you, Kate. All right, if you'd like to learn more, we'll include links to the stories we discussed in the show description. This month, Rita also wrote about why alcohol labels don't warn that drinking causes certain cancers. And check out our new data brief on how and why healthcare spending varies across the U.S. And finally, our interview series on artificial intelligence and clinical practice continues. You can listen to these episodes in this show's feed, at JAMA Network's YouTube channel, or at JAMA.com. Or better yet, follow the new JAMA Network podcast, JAMA Plus AI Conversations. That's it for this JAMA Medical News Summary. I'm Jennifer Abbasi. Thanks to Kate Schweitzer. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next time.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.